Awesome. Welcome to Planetary Health First, Mars Next. And we are live at Health, not Mars, but Vegas. I'm super excited. I have Todd with me. I got Steven. And tell me a little bit about yourself, Todd.
So I'm a partner at the law firm of Crowell and Mooring in Washington, D.C. We're a full-service law firm that has very large healthcare regulatory and transactional practice. And we spend a lot of our times working with early-stage healthcare companies, larger healthcare companies too, trying to help them navigate the minefields that bring products to market without finding out that there's a surprise along the way that's going to keep you from getting there. Steven?
And I'm Steven Bentfield. I'm a partner in Crowell and Mooring's Denver, Colorado office. New partner to the practice and spent 11 years in-house with a large dialysis company headquartered.
Wow. I think I've heard of that one. DaVita or something like
might
that?
be.
Yeah, I think it's all over the place, right? It's a Warren Buffett portfolio or something,
It sure
right?
is.
Wow. So I'm really glad you're here. I know I don't want to get any lawyer jokes. I mean, you guys get a bad rap, unfortunately, but when you need a lawyer, you need a lawyer. And it's real stuff. Healthcare is super wicked complicated. And especially as founders, you guys are really like, founders should not venture alone, right? And so, what is the challenges like that happen when founders don't get things right? I mean, I can only imagine the layers from getting into the FDA, I mean, med tech, I mean, everything. So, you know, we don't have all day here. We got a few minutes. So where should we start on this kind of conversation today? What would be a good starting point?
I would start with thinking about what your crown jewels really are, right? Your crown jewels are the idea and the intellectual property and probably the data that go to making that idea a reality, something that's commercializable to you know, a larger healthcare company who's going to be your customer. And so you need to be thinking about how to protect that intellectual property, how to make sure that the idea that you have, you know, can hunt from a regulatory standpoint, right? Is it going to be able to be reimbursed by Medicare? Is it going to wind up with the person who's buying it and using it having some sort of a compliance issue? You need to make sure that you understand what those risks are in order to structure your business model in a way that avoids them.
So I'm thinking of startups. A lot of times they don't have money. So when do they find it? They have to raise money? Like where do they come in? Obviously, you know, you don't want to start too late, but like tell us kind of how you guys work a little bit.
And I would say that, you know, law firms tend to understand the challenges that startup companies have, right? Oftentimes we're able to, you know, work on a reduced rate for an early stage company. We're in it for, you know, building a partnership, looking at the future. If we see an idea that we think is going to do well in the end, it's almost like a VC situation where, you know, at our firm, we're not taking equity, but we are betting on the long term for clients that they're going to grow and we're going to be able to be riding shotgun with them.
And if I can say, it's an area where you don't want to underinvest, right? Because the worst case scenario in healthcare is you back into a compliance violation, you get investigated, enforcement action by DOJ and by HHS, and the baby that you've created, this thing that you've formed, gets taken away from you.
And the payers are going to know it, the provider systems are going to know it, and the venture capital funders are going to know it. And so if they know more than you do about the problems with your business, then you're starting off very far behind before you even have the big conversations you need to have.
Tell me about yourselves. Like, how in the world your attorneys, I don't think you were 5 years old and said, you know what, I want to get into healthcare law. So tell me a little bit about yourselves.
So I knew I wanted to be a transactional lawyer because it helps people accomplish their goals. I never wanted to be in a courtroom. I never saw, you know, the documentary LA Law, whatever it was. I'm dating myself. That made me think that, you know, litigation was so fun. And I really wanted to do something constructive. And healthcare has the benefit of helping companies grow, but also helping real world problems. I find that my clients are very passionate about the solutions that they're bringing to improve people's lives.
And Steven?
For me, it's actually sitting down with clients and just figuring out what it is they're trying to achieve from a business standpoint, and then figuring out how the law is going to impact that and finding the solution. So it's almost drawing it out. I'm a visual guy. It's drawing it out on a piece of paper, figuring out how the dollars move around, figuring out how they're you know, attracting customers. And how they're going to deliver their product, and then structuring the deals around it.
So I imagine you guys are needed in so many areas, from value-based contracting, right? From med tech, med device, like regulatory. Because I was in Toronto last week at the med tech conference, had a lot of regulatory discussions. That is super complicated. All I thought of is I was thinking, are all these people that are working for these big companies, they must have a law degree, because I don't see how they understand the complexities. So
you need a hotline.
Yeah,
you need a hotline. You need to be able to phone a friend when you're getting in trouble. Even me as a transactional lawyer, privileged to work with top-notch regulatory lawyers who are also understand the transactional side of things. And when I see an issue, I can phone a friend and figure out exactly, what the solution should be to that issue, whether it's on the digital health side or the fraud, waste, and abuse side or Medicare regulation side. You've got to know how to spot the issue, see it coming, and then figure out the solution.
So you guys are both here at Health. What are some of the things that really you're seeing as opportunities? What's getting you excited at Health?
What's getting me excited is the hunt to try to figure out who's real and who's not, right? Everyone's got an AI solution. And trying to just get smarter and identify, as I said earlier, which ones are ready to hunt, how they're going to be able to be commercialized and sustainable, and, work within the regulatory frameworks to find success.
And you touched on value-based care, and that's a specialty of the area that I've focused on over the last 11 years.
Oh, wow.
And it's really, that vertical integration between the payer, the providers, and then sometimes downstream organizations, and how they can better collaborate and take risk on populations of patients, improve quality, improve costs, and actually make money doing it.
The money is important.
Money is important.
Yeah, I mean, really.
And the real step to money is data. And what you're seeing with AI and you're seeing with better data sharing capabilities is speed to access to actionable data is increasing. And that's really going to help people, maximize those opportunities.
Well, Todd, Stephen, I'm so glad you came on. I'm so glad we connected. Is there any other things that we've left that we should be talking about as we wrap it up?
Call your lawyers.
I'll frame that slightly different. When I start with someone who's new to healthcare, if it makes reasonable business sense, it's probably illegal in healthcare, but we can help you navigate that.
So basically anything that makes sense, like, you probably should talk to attorneys about it, because it's healthcare. It's not supposed to make sense, I guess. That's kind of
and there's a left or a right to take that's going to make it make sense in the end and make it work.
Cool. Well, man, I'm so glad you came on today.
Thanks, Michael. This was fun.
Appreciate it.
Awesome.
Thanks.